And within 2 or 3 months of medications, doing a specific form of treatment called hydrofacial, where we suck out all the black and white heads externally, and then we do the laser to correct the pigment and the blood vessels. This is what we managed to achieve after 4 months.
Aesthetic medicine, making you beautiful, right? Now, about aesthetic, what good does aesthetic medicine bring to people? Tell us about aesthetic medicine in general first. What is that?
Okay, aesthetic medicine is defined as the art and the science combination in improving a person's appearance. That's basically a definition. And that definition can be quite fluid. Why? Because if you feel that you've got enough hair, and I was going to tell you, I can make you grow more hair, you will not be happy with me. So the definition of an improvement in appearance has to be the marriage between what the patient wants and what the doctor wants. I think that's the most important aspect. When that starts to diverge, you start getting horror outcomes, where things don't look so good, don't look natural, and in fact, maybe over the top, to the point that there are people who will be kind enough not to say anything, but they clearly feel that it's distasteful. And I think we have to be very careful, because when aesthetic medicine is overdone, you can have adverse outcomes. It actually makes it look worse than before.
So let's see some of the things that you do. Let's switch to the slides and presentation that we have prepared earlier. So this is some of the things that Dr. Yong, Dr. Adrian, can I just call you Dr. Adrian now?
Yeah, that's fine. Yeah, that's fine.
That is easier. This is some of the things that you do, and I can see eczema on children. Is that eczema on children?
Yes, very common. Very common.
My second child actually suffer from this very much. Yes. So you do see eczema,
yes,
in adults and children as well, right?
Yeah.
So.
I'm proud to say, out of all the eczema patients that I get, I tend to get the very complicated ones, which is good. Why? Because they have been to probably 4 or 5 other doctors, and they've not found a solution. And it's very satisfying when I can get to the bottom of things and give them a cure.
That is great. For that, I must compliment you. A lot of people actually look for the easy way out. I've seen one of the dentists that I saw. I went in for a filling. I said, could you actually, he did a temporary filling the first time, then second time it came off, I went back. And he gave me another temporary filling. So I told him, doctor, could you give me a permanent one so that it lasts longer? You know what he said? He said the temporary one lasts you for 8 months. What's wrong with that? I'm like, oh my God, a lot of people look the easy way out. Yes. But I like your attitude. Your attitude is that you like to do the hard thing and get it done.
Yes.
My third child is actually grown out of eczema. That's a lucky thing. She still has some problem. Maybe later you want to see her. All right. So tell us about this, Adrian.
Yes.
This is, what do you call this condition?
This is vitiligo. Vitiligo, vitiligo. And it is an autoimmune condition, which means your immune system decides to attack your own pigment cells. So the pigment cells reside on the top layer of our skin, okay? And the purpose is to give us sun protection. So for pigmented skin, for example, Chinese, Malay, and Indian, African skin, in the order of getting more and more melanin or pigment, it becomes more obvious as a problem if you're dark skin. Okay. So vitiligo still exists in Caucasian people too, but they are never as psychologically affected as the darker skinned people. And in fact, such a condition in India is thought to be a condition where a potential son-in-law would be rejected. Why? Because this condition actually mimics or looks like very much like leprosy. So leprosy can be white, it can be a rough patch, maybe they are losing nerve processes and limbs and so on. So I think this is a condition which is very emotionally loaded, okay, in the sense that it really affects someone's self-confidence. And I know of my lady patients who have this, and they would spend at least 10-15 minutes every day just to make sure that the makeup will cover it up before they leave the house.
Now, is there a cure for this or not?
Unfortunately, not at this stage, but I would say that there are a lot of treatments available to control it. So creams are always the first line, and then phototherapy, which we offer in our clinic. And then thirdly, pigment cell transfer, which is surgery, to transfer the pigment cells from one area to another. A bit like hair transplant, but using the transfer of pigment stem cells into the site.
So, can our patients go and see you on this?
Yes, they can.
Do you do this surgery and do this transplant and all the lasers that you're saying just now?
Yes, we do. Yeah.
So how was it? Will it actually 100% cure or make better like 90% or 80%?
Now, with time, given 3 to 6 months, I would say that majority can improve by about 70 to 80%. Okay?
That's not bad.
Yeah. However, certain areas, for example, around the mouth and on the back of the hands, those are the most challenging parts where we have to keep hammering with a very, very high dose. When we say hammering, it refers to using very high dose medications and also using phototherapy at high doses to try and achieve what we need to achieve. Yeah?
But yet again, it is much improved, you know?
Yes.
Okay. So if you have, to the audience outside, if you do know somebody who have this problem, Dr. Adrian is somebody that you can go and have a look and see him. Now, this is skin cancer and psoriasis.
Correct. Yes. So skin cancer on the top is also known as pigmented basal cell carcinoma. Now, this is very common. So basically, the risk factors are excessive sun exposure, genetic background risk factors. So it can occur anywhere, and the scary part, it may look like an age spot. And very commonly, this is underdiagnosed in Malaysia because very few of us would think of it. But having seen about 10 to 20 a day during my training in the UK, I would recount the experience in UM when a patient came in and kept telling me about his legs, and all I could do was stare at his nose. And he said, "What's wrong with me, doc?" And I said, "You have something that's a lot more important than what you're trying to tell me, and I think we should remove it today." And
Which is a skin cancer.
True enough, yeah. 2 weeks later, the biopsy came back, and of course we treated his legs as well. But it was one of those stories that I always remember. Yeah.
Right. So psoriasis is something it happens on the scalp, but sometimes it happens on the other part of the body as well,
Yes.
right?
Now, the thing about psoriasis is it's not just skin. It's not just a skin disorder. People will see it as a disorder that is psychologically and socially unacceptable. They can't go swimming. They're embarrassed. Every time when they sit down on a sofa like this, when they leave a lot of dead skin behind. Okay, those can be embarrassing factors. However, what is important is the fact that psoriasis is associated with other conditions. For example, joint problems, known as psoriatic arthropathy. So the arthritis is very similar to things like rheumatoid arthritis, where you get joint stiffness, pain in the heels, maybe in your knees, your hands, and you can't really move properly for about half an hour. Then that gets better. Then nail disorders, where the nail will start to lift up, become very brittle, and you would want to hide them because they're very unsightly. And then, of course, the hidden diseases. So metabolic syndrome, like diabetes, hypertension, high cholesterol. Those have all been linked to psoriasis. So for all my patients who have psoriasis, I always tell them to try and reverse all those risk factors, and their psoriasis tends to get better as well.
I have a friend, this young guy, who is in his, mid-20s, and he has this problem of psoriasis on his foot. And I've seen quite a lot of dermatologists, and he has been doing injection.
Okay. Yeah.
And he said it helps, but once it's off the injection, it comes back again. What do you say about that?
Yeah. So it depends on what kind of injections you're referring to. But of course, if it's the biologic injections, which are can be on the pricey side, it actually tackles the whole root cause of the problem. But of course, we can't get to the absolute root, which is gene therapy. Because the problem is with the genes, and that is expressing itself in a way that causes the skin to turn over very quickly and to promote inflammation. Yeah. So things like, for example, alcohol consumption, stresses, and taking the wrong medications can cause a flare, right? Now, so the injections, the fact that we can get to a point where injections can control it completely, meaning that you might see him on a day-to-day basis and you think he's been completely normal, I think it's a good enough progress for the moment, okay? But they're of course very expensive. very pricey to maintain. Yeah, you're talking about 30 to 35,000 a year. Okay, it's like paying for a private school fee for the rest of your life, because basically this condition can last 10 to 15 years. All right, but the better way is to look at it more holistically. If you can make lifestyle changes, dietary changes, that will be of course good. And of course, if you use topicals, phototherapy, and other tablets and treatments that are more cost effective, that can make you go further. Because the average cost of all the other things are around 5 to 10,000 a year, rather than 30 to 40,000 a year. Yeah.
So some other things that you do, let's go to aesthetic, right?
Yes.
So let's go to the interesting part,
Okay.
aesthetic medicine. Now, this is, what is this? Tell us, what is this?
Okay, so the picture of the lady before is the same lady as the one that's below. But the difference is, number one, if you look at the forehead lines on the top, okay, which we can reproduce here, and also when you smile and you have this crow's feet at the side. Now, all these are due to muscle overactivity. And a very common problem that people have when they are getting old is that they start to have, long-sightedness, and they have to keep doing this. And the line in between can get very deep, and the 11 lines become extremely deep and unsightly. There's also habitual movement, where every time when you talk to them and they just do this and this and this, and then they have those exercise book lines on the top. Yeah. So these things can be solved by injecting very small doses of Botox. And when I say small doses, I mean small doses, because the Botox was something that originated from the US. And the doses, just like the portions of the food, are a little bit larger than what Asians consume. And I think that's where the translation of practice is a problem. When you start using the American or the British system in terms of the dosing, you run into problems.
Yep.
And I certainly had that experience when I first came back from UK with that.
So now, Botox, is it safe?
Yes, it is a very safe medication, FDA approved, provided it's original Botox. So the horror stories that you've heard is unlicensed products, pirate copy products, products that are injected by non-medical staff that may be diluting it or mixing with other contaminated products.
And I heard people telling me on the internet, they say after you put in Botox, if you put in too much, then you have what we call the plastic face syndrome.
Yes.
So does it really cause that, Botox?
Absolutely, which is why I say if you follow the charts of the originator, the people who actually started using Botox initially, and you just follow it by the books, you will get a plastic face. But if you start using it in adjusted doses according to how much muscle activity, and you tailor make it to your muscle activity, then you'll be very natural looking.
Aha.
So you have to be very careful. Yeah.
So ladies, you heard him. It takes skills to do Botox. So you better do it with the right guy, right? Better do it with a legal practitioner, a person who really knows how to do this. All right. So now we know the answer. So let's go back to this. This, wow, my mother will love you. My mother have this, and she's trying to get rid of this. So these are what they call it, sun freckles,
Sunspots or solar lentigo. Okay, and these are accumulated over the years, and it may show her commitment as a good mother for bringing her kids to school, driving them, or even walking under the hot sun, and that's why there's so much sun. Or maybe she was working a stall, so on. So these things are accumulated sun damage to our DNA, which has caused this protective mechanism to appear. But it does make you look more, unclean, and perhaps less desirable, okay? And less confident perhaps, because when this lady came to me, she was putting a lot of foundation makeup over it. When she first came, she said, I have a big pigment problem, and I couldn't see it at all because it was covered with thick makeup. But that's the final result without makeup, and she was very, very happy after that. So I think, there are technologies, not everything should be lasered, okay, beware, because there are certain conditions like melasma, which is actually a hormonal condition, which is a little bit like vitiligo, where it's not curable. And one has to be careful that laser isn't an answer to everything. A lot of patients come in and say, okay, I want this laser, I want that laser. Then when I tell them what can be lasered and what can't be, bring them down, then you can understand what can be achieved and what can be achieved safely, rather than, you know, something that you imagine from other perhaps advertisements that you've seen. Yeah.
So at the end point is actually going to see a person who actually really knows how to do this, not just a deep derm, you know, diploma in derm. There's a lot of GPs who take deep derms and say they are derms, right? But actually to see a real dermatologist, right? So this lady, so this looks like a facelift.
Yes.
Is it a facelift?
Well, it's a non or minimally invasive facelift, in the sense that in the olden days, plastic surgeons, derm surgeons would actually excise the areas around here on the sides of the ear, and then stitch up the whole tissue to pull up. So
Excise means cut.
To cut, yeah, to cut.
Yeah.
But nowadays we can use less invasive methods. So you can see the 4 little plasters there. That was to mark out the areas where we've put a thread in there. So you know the threads that are used to stitch after you've had surgery, after, let's say, you have a C-section, you know, that kind of stitches. But this is modified to last longer, about 9 months, a year. And not only that, the stitches have actually been adapted and made to have little barbed areas on the side to be able to lock down the tissue and suspend it. So this can be done on an outpatient basis. You don't have to be put to sleep. Okay, it's just injected with local anesthetic, and you can achieve this. You walk out in half an hour.
So you are saying I can get a facelift without cutting through my face from my forehead to my ear, but actually put a thread across to get the same effect.
Yes.
And safer.
Yes, certainly so.
Wow. So the plastic guys must still, do they do the same thing?
Yes, the plastic surgeons actually do threads. There are also other technologies like high intensity focused ultrasound, which is a machine-based device to try to achieve the same thing. But of course, for the more severe cases, you know, if you want to subtract 15, 20 years, then facelift is still the way to go. The durability, yeah, depends on how long you want it to last. But most people nowadays, they're healthy, they're fit, and they don't want to undergo surgery. They don't want to have a long downtime of hiding away from people for 3 weeks to a month. Even with the MCO and even with the mask regulation, they're still very wary of having that kind of downtime. Yeah.
Now, tell us, Adrian, how young can a patient come and see you with this?
For facelift, like this? Okay. So for a track facelift, I would say that the ideal candidate is someone who have lost some weight, okay, and perhaps has some sagging fat, which is descending, earliest possible mid-40s. Okay. Now, if you're younger than 40, then I would suggest doing high-intensity focused ultrasound, which is a machine-based device first, to maintain it. Because having a thread put in at that age might put you off beyond that. Because once you put a thread in, of course it's a procedure, there is a material that is in there that with time will start to stimulate the collagen and tighten up. But there is a material there that will change your face structure. And you would only want to do that at a later stage when your bone starts to recede, rather than when you're still young and you have a lot of volume to make up for it.
So the thing is that do not do it too young. Do it at around mid-40s or early 50s.
Yes.
Yeah. So ladies, you heard it. Can men do it?
Yes.
Do men come to you and do it?
Yes, they have. And mainly, actually, it's more popular for men because guys are more like, the way they shop are very similar to women as well, where they want a quick thing. They walk in, they get it, they walk out. So actually, more men than women prefer this approach to lifting. Yeah.
Right.
Because it's a quick fix. Yeah.
So do you think I need it?
Well, I think you're perfectly fine at the moment. You're looking very healthy.
You're just too nice. So let's talk about this.
Yes.
So what's this? This is like a...
Okay. So the first thing to look at is the lower eye bags in the before picture, in the top picture. And then below you can see the eye bags disappearing somewhat. And what I've done there is inject fillers just under the groove here, on the bone, which does two things. Firstly, when you put more volume here, it lifts up the skin and create this lifting effect. So the cheeks don't look so heavy anymore. Secondly, you can also open the eyes up and the eyebrow by injecting a little bit here. Okay. So it's basically like scalp facing, the face sculpting, sorry. Yeah, face sculpting, where basically we are injecting the fillers in to achieve the shape that you want. So the same thing can be done for the chin, same thing can be done for the nose, and so on. Yeah. The other common indication is having sunken temples. As one gets older, it gets very sunken in and look old. We can actually inject fillers in here as well to fill it up on the sides.
Now, you're injecting what kind of material? Silicone, Synthol, or? No.
Silicone is no longer used, and it's a very dangerous product to use.
It's illegal to do that, right?
Yes. So we use hyaluronic acid now. So hyaluronic acid is actually part of our skin. We produce hyaluronic acid, okay, and it's broken down by an enzyme called hyaluronidase, which is present under our skin as well. So the difference with the hyaluronic acid, which is injected in, it's processed such that it's cross-linked so that it will last longer. So about a year and a half for it to last there. And the way it works is it draws fluid in so that it allows the tissue to look plumper and have more fluid.
So it's not meant to last forever?
No.
So basically, after 1.5 or 2 years, they have to come back and redo it again?
Yes.
Something like a repeat procedure to make you continuously look young?
Yes. However, the reason for that is very good. Why? Because, for example, if you were to inject a fixed material like silicone in there, okay, like for example, you are 48 now, and you think, okay, I'm deficient here, I'm going to inject silicone there. Now it will look good. 5 years later, maybe not so good. 10 years later, it will look awful. Why? Because the bone recedes with time. The eye socket deepens, the bone recedes, the skin gets loose. So what happens is you're left with lumps that stick out, which are permanent there. Whereas your skin has been hanging down like drapes or curtains, which are already not supporting the structure, and the bone is already gone, far gone. So you have like a tennis ball or whatever under the skin. So having permanent things injected is never a good idea, because our aging process is a dynamic process, and so should beautification be. It should be dynamic as well.
So basically, generations of Hollywood actors has went through the knife and went through all these to give the younger generation of dermatologists some insight not to do.
Yes, I mean, we learn and we get better with every generation. So it's easy to look back and say, oh, how come that was done? Just like how we're using smartphones now. And in those olden days, it would be those big Mobira phones, right? That you carry and plug into the back of your car.
You can kill a dog with that. Okay.
Yeah, that's right.
So let's continue. Okay, this is acne.
Yes.
And I think this is very satisfying, right? You've helped a young girl, a beautiful young girl, to regain 100% beauty. She's a beautiful girl. Tell us about this case.
Okay, she's actually working in a big pharma company, and she came to me very depressed. And she said she's actually from another country, but I can't mention for anonymity purposes.
No problem.
And she said, you know, I've been to 3 or 4 doctors, okay, aesthetic doctors as well, and I've had a few injections, a few lasers, but things only got worse. Then she's been for lots of different facials, and still things couldn't improve. And I spent about half an hour, 45 minutes explaining to her what the root cause of the problem is. What causes acne? Dietary causes, genetic causes, okay? Lifestyle factors. And what is the root cause of the problem is the sebaceous gland producing too much oil, and you're in a hot, humid country. So what can you do to stop that? How to modify your diet and so on. And within 2 or 3 months of medications, doing a specific form of treatment called hydrofacial, where we suck out all the black and white heads externally. And then we do the laser to correct the pigment and the blood vessels. This is what we managed to achieve after 4 months. Okay? And
this is amazing, right?
Yeah. So, and the story to this after that was that she told her aunt, who was based in London, and said, can you recommend someone in London? So I gave her some names. And then the message back to me was, your friend is very expensive. So I said, why? Oh, for consultation is £290 for 15 minutes. And with £290 in Malaysia, you can get one whole session done, medicine, facial, and the laser with me. And so she asked the aunt to fly home, £500 flight, and she stayed for 2 months to fix her face. And then she went back to the UK.
Oh.
Yeah. So that was a very, very satisfying, sort of thing to be involved with.
So you could do actually tourism medicine.
Yes. I've had patients who have come from Bali, from Indonesia, Caucasians, who have had skin cancers, and they will come to the clinic and they say, there's a list of budget hotels opposite my clinic. I'm not sure. Yeah, you know.
Yeah,
So
I know.
there was a patient who came on a Monday. I did the surgery, and then reviewed him on Thursday, Friday, and then when I gave him the green light, he flew back to Bali. So he was staying opposite my clinic for 5 days. Every time I just peek out the window and I'm open, he will just walk down and come and see me. So yeah.
So basically, you do your surgery in your clinic, right?
Correct. Yes.
Inside your clinic. So you have a full surgery room ready there, and
Yes.
and there's not many dermatologists actually does that. It's very, very few. You are about the first guy that I know who actually does dermatologist surgery. And okay, this is getting very interesting, Adrian. Now, this young guy, same thing, acne, but this is a bit more serious, right? He has bad scarring,
Yes.
but you managed to actually basically smooth out the scar. What do you do?
Yes. Okay. Very interesting story with this one, because from the time when we started using lasers, I've always thought that we have to use surgical methods. And the conventional teaching that I was taught as a dermatologist in the UK was to use punch excision, where we use a piece of metal to grind a hole and then lift it up and then stitch it, because those are holes, right? Okay. So lasers back then, we had carbon dioxide laser, burn the whole layer off and then let it grow back. It's like polishing a marble floor. But when I came back to Asia, I realized you can't do that, because if you do that to a Chinese skin, they will come back looking like someone has robbed them and they have been dragged on the road. It's all brown and all pigmented after that because of the sun exposure and also the post-inflammatory hyperpigmentation. So I'm fortunate enough to have been able to explore on a few relatives, okay? And I was, this takes a lot of trial and error. So I went through a number of laser machines, and we went through a couple of different settings. And it took me about 9 months to hone this. And we managed to find a setting whereby we can do the laser, you can go off on the beach in the sun, do whatever you want, there's no restrictions, and they come back looking like that. So I'm very proud to say that we can do something as drastic as that without surgery and without the risk of pigmentation.
I mean, seriously, to all my clients and all my audience out there, if you want to get your skin done, please go and see him, right? If you have insurance policy with him, my insurance will pay, But make sure you can see him. Right? So now, tell us about this. This is double eyelid. Yes. I thought this is done by plastic surgeons, but you are doing this as well.
Yeah. So for skin cancer work, we do remove lesions, growths on the upper eyelid,
yes.
on the nose, on the side of the temple, and so on. So this is a fairly simple one. I don't do lower blepharoplasties, because the lower ones I normally refer to my oculoplastic colleagues. But for the upper lid, this young lady basically said that one side was not looking quite the same as the other. And from the top, there's a lot of hooding, too much extra skin. Okay? And she wanted something more permanent. So this was fairly simple. It's just taking a bit of extra skin off and then stitching it together. And the recovery is pretty quick for a young patient like her. Okay? But bear in mind, it's not suitable for everyone, and surgery is not always the answer. There are a lot of devices out there, a lot of other procedures like thread, filler or Botox, or even high-intensity focused ultrasound, that you can achieve a more satisfactory results without having to undergo the knife. So even though as a dermatological surgeon, we have the option, but we can always go, easy by using all the other treatments that are less scary.
So let me just put it in contrary. After listening to you for half an hour, anything to do with the face, if it's not involved huge surgery, you can actually do it.
Yes.
So anything that involves a huge surgery, take example, rhinoplasty, to lift up your nose or thickening your lips, all these are done by plastic surgeons.
Plastics and some ENT surgeons as well.
And ENT surgeons, yes, I heard ENT surgeons. Yes. So, but anything superficial on the skin, you can solve that.
Yes, that's right.
You got it. So he's the guy to see. I now know who to see on the skins. I'm going to recommend a lot of clients to you. A lot of my clients are all these rich, middle-aged ladies who love to come and see you. So now, tell us who should avoid aesthetic medicines. Who should actually avoid it totally?
Okay. Now, people who should avoid aesthetic medicine will not have insight, meaning that they would often go from one doctor to another. And by the time they come to you, or me rather, they would say, actually, I've already seen 2 or 3 other aesthetic doctors or plastic surgeons, and they keep telling me I shouldn't do it. That's always the alarm bell. And to me, that is an issue with self-image. And I think with that, we would actually need more psychological help and psychiatric evaluation. Okay? Now, I'm not talking about people who are seeing things, hearing things, or think that other people want to kill them. It's basically the people who, when they wake up and they feel that, for example, their right eyebrow is much higher than their left eyebrow, and they're very fixated on that. The moment you say it's not true, they get really angry with you. And I think those people should stay away from aesthetic medicine, because it's a very dangerous field in the sense that you would be correcting, or rather in the surgeon's eye or the doctor's eye, it would actually be worsening of their looks. But to them, it is improvement of their looks, which comes back to the point of the definition of aesthetic medicine.
Yeah.
So when the two doesn't marry and doesn't agree, then one should not pursue it.
So there is in America, there's this guy called the human version of Kent. You know the Barbie doll Kent?
Yes.
Have you seen that guy?
I haven't.
That guy had that guy has done like maybe 60 plastic surgeries on him. What is wrong with this person? Tell us. I mean, as a doctor's point of view, we're not passing judgment. We're just purely engaging in a conversation on this. What is wrong with people who go through like 80, 90 plastic surgery to look so artificially pumped up? What is your view on that?
Yeah. Now, I think aesthetic medicine is interesting because it's a little bit like art, where it's very subjective. Okay? Subjective in the way that if you had the definition of yourself looking like you were 20 years old, even though you're 80, okay? Some people may perceive that as being all right. But for other people, they would think, look, you're my classmate and you look like that when you were 20, but now when you're 80, you should look a little bit closer to maybe 60 or 70 at least. And I think that is defined by human norms, by society, right? So it's a very difficult question to answer in the sense that it places a judgment on the value of what is important and close to you, okay? But what I can comment on is the fact that if you had a significant problem with your skin and that stops you from doing the job that you want to do, for example, if you're an air stewardess or someone in the service sector, and you have a really bad, big pus pimple on the cheek, and no one wants to see you, right? So that clearly is a real medical issue that translates into benefits of aesthetic medicine, improving your quality of life. But on the other hand, if you are in a position where you are trying to improve yourself beyond what normal society would expect, then I think that's when people start to raise eyebrows. Yeah. So, but I think each person for their own. I think these are personal values.
True.
It's difficult to comment.
I think it's personal value. I think it is his choice to make. And I do have a doctor who is a plastic surgeon, one of the best in town. He told me, Renan, you cannot believe one thing. Throughout my 25 years being a plastic surgeon, the prettiest girl will come to me and tell me they want a boob job. And the doctor will say, he said, Renan, they have the perfect boob. the perfect body and they still want a boob job. Sometimes you have to spend hours to talk them down. You know, it is personal thing. You know, you might see a beauty in it, but she doesn't. She wants it better. You know, and that's not. That is personal preference, I would say. You know. So tell us, where can we find you?
Okay, so you can type into Waze, AY Skin Specialist Clinic, and it will bring you straight there. That's it. It's as simple as that.
So his clinic is right opposite Starling Mall. It's at Damansara Uptown. It is very easy to find. It is just on the main road. It's very easy to park. There's no reason say cannot go get parking, cannot find you. And I would like to say thank you so much. Thank you, Adrian, for coming to the show. And I think whatever you have shared with us gave us value in understanding aesthetic medicine and who should do it, who should not, what are the safer way to do it. And for Asians, I think you have carved out a new, basically a new kind of treatment, like to take care of Asian skin and in our weather. And then that is applaudable. So anybody who has a skin problem, please go and see Dr. Adrian Yong. If you have a problem with the insurance policy, come and see me. I'll sort it out for you, right? So any last word for the audience before we go?
Thank you very much, Ren En, for inviting me. And this is a very unique platform to share this with. So thank you once again.